This week on Empowering Midlife Wellness, we're talking about how to use different testosterone products. We've got male products that we can divide the dose and use the appropriate amount for a female. We've got compounded products. How do we know which one's best? I'm going to give you a live demonstration today and show you just how to use these, if that's your choice. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated to taking care of women in midlife. That's women just like me who want to feel great now and also feel great as we age. Well, we have talked a lot about testosterone, but one of the things that I want to clear up is some of the different ways to use it in a topical form. So if you haven't heard me talk about this before, I'm going to do a little brief review of why it's a bit tricky. Now, testosterone currently is not FDA approved for women. That does not mean that it's bad. It just means that that hasn't happened yet. And there's a lot of reasons why it's not FDA approved that have got to do with politics and sexism and the fact that money's not spent on female sexual health and other things like that. Not because it's bad, because it's really generally accepted amongst educated gynecologists, certainly menopause specialists, that testosterone in the correct dose for a female, that means elevating levels just back to what was physiologic for a female when it was higher for us, not supraphysiologic. That means we're not getting very high levels of testosterone, but simply replacing it has been shown in very good studies, the ones we call randomized controlled trials, to help with libido. Now, the main thing that we recommend it for is libido because that is the only thing that's been studied for. That's also called Hypoactive Sexual Desire Disorder, HSDD. So you know when you have that, ladies, it's a lack of desire, but some of the questions I've mentioned before are, did your sex drive used to be better? Because maybe you've never had any sex drive and it's nothing to do with testosterone. Number 2, do you wish it was better? And number 3, related, is it bothering you? Is it causing a problem? So if your sex drive used to be better, now it's not as good and you want it to be better and it's causing you some distress, then treating it makes sense. You have this diagnosis of hypoactive sexual desire disorder. We call it low libido. And testosterone helps. So it's pretty universally accepted that testosterone is a good treatment. In fact, it's the best treatment that we have for HSDD. Now, it's been studied in postmenopausal women, so currently not recommended for premenopausal women. However, it works for any female who has low testosterone. Now, it doesn't work if you don't have low testosterone. So just like for men, they're treated all the time for low testosterone, and there are levels at which that diagnosis is made for men. For women, there's no consensus. I mean, nor is there for men really either. It's often just how you feel and then doctor and patient together making a decision. However, we've talked before about something like 50 to 100 nanograms per deciliter, and that is total testosterone, is about the highest that it ever was for a female. It does not need to be over 100. Now, in the studies on testosterone, they didn't do blood levels. It was really patient perception, so there's not a lot of consensus about this. But I personally wouldn't treat a patient who came in with a testosterone over 50 because she doesn't have low testosterone. I'd be looking for a different reason that she has low sex drive. Now, that being said, I've told many of you before that my testosterone was 0 when I was 45, and now that it's, last week I checked and it's 78, I feel great, and my libido is healthy. I feel like I have more energy. That's never been studied. There are some anecdotal reports that it improves muscle conservation and bone health, although we have to be careful to not use it for that indication because the primary indication is for sex drive, but we do get that additional benefit, most likely. No indication that it causes any kind of cancer. Remember, this has been there all of your life. So, in other words, using testosterone is not really questioned. It's the dose and the delivery method that's questioned. Now, in other countries, and I often talk about Australia, but also New Zealand, they have government-approved testosterone for women in the form of a gel. So we know about the dosing. We can use the data from other countries. Typically, we want to start on about 1/10 of what men get. So typically about 5 milligrams a day if we're using a topical gel or a cream. Now, 5 milligrams a day in Australia is the low dose. They have two doses, 5 milligrams or 10 milligrams a day. Now, for men, it would be 50 or 100. So very, very different dosing. And for men, we would want the blood levels to be about 10 times higher also. So completely different. We're not trying to give male levels of testosterone. We're just trying to restore testosterone to similar to what my 20-year-old girls have, which is somewhere in the 60 to 70 range. That's normal for a young woman. And in many cases, it does restore our libido. Okay, so we mentioned, at the beginning, I mentioned that testosterone is not FDA approved for use in women in any form in this country for complex reasons. That does not mean that it's bad. Again, it's universally accepted, with very few exceptions, that it's very good, especially for sex drive for postmenopausal women. So then how do we get it if it's not FDA approved? Now, one of the ways we could get it would be to use an FDA approved male product. That would be the only way that we could get FDA-approved testosterone. And it sounds like a fantastic idea. A lot of my colleagues talk about this on social media. They say you should only use FDA-approved male testosterone, and I think this is a fantastic idea. I'm on board. The reality is it's really difficult, and I want to walk you through how hard it was for me to get this for myself. I had one of my partners prescribe it for me to see what you have to go through to get testosterone from the pharmacy in the male form and then to divide the dose to make it appropriate for a female. It's quite difficult. You have to be very, very patient and persistent. So that's one way to do it. We could get 5 milligrams of testosterone in the male form. To do that, we would have to divide the male dose significantly. I'll show you how that could be done if you wanted to try it. Another option is to get it made by a compounding pharmacy. Now, there's a lot of people don't like this idea. They have a lot of, what I will just say, prejudice against compounding pharmacies because compounding pharmacies are not regulated by the FDA the same way that regular pharmacies are. These products are made by individuals, not by a big pharmaceutical company. So for sure there is less regulation. But compounding pharmacies do have regulation. They're not unregulated. They're not making crazy poisonous stuff. And if you find one that you trust, and we certainly have several that we use in our practice that are very trustworthy, that product's going to be pretty much the same as what you can get from an FDA-approved pharmacy. Stuff you get from a pharmaceutical company is going to have a range plus or minus 5%, and that's acceptable. Many compounding pharmacies have an even more stringent testing guideline. So just to say compounded products are not in and of themselves terrible, you just have to have a really good compounding pharmacist. It's also not true that it's more expensive to get it from a compounding pharmacy because testosterone is not going to be covered by insurance because you're not a male. Very, very frustrating, but I'll walk you through the story of what I had to go through to get this stuff. It didn't end up being less expensive. It's certainly much more difficult to deliver. So yes, we could use FDA-approved male products, and I'll show you how to do that. It's a valid option, and it's got some difficulties. Or you could use a compounded product. Also a valid option, much easier, but you have to have a really good compounding pharmacy. So I'm going to show you these products that I have here, and let's take a look. Because remember, we want to get an average of 5 milligrams a day. And that is if we're starting with very low testosterone. If it's already over 50, you don't need to be treated. If it's close to 0, we would start you on 5 milligrams a day and then possibly increase it based on your blood levels that we would draw 6 weeks later. So how do we get 5 milligrams a day? I'm going to start with the easiest one. Okay, I'm going to make a little bit of a mess here, perhaps. Now, this is compounded testosterone gel, and it's in a metered dose, little applicator, such that when I turn it, that is 2.5 milligrams. And I just put it on my inner arm, and that's it. Done. Now, I would do that twice a day, morning and night. Give it a click, and that's how much I would put on. It's pre-measured for a female. That's going to give me 5 milligrams a day. Now, that's pretty accurate. I don't have to look at it. I don't have to divide it. It's measured to come out in exactly the right amount. Now, that's pretty convenient. So this little bottle, which would last a month, cost about $45. Now, different pharmacies are going to have different prices. Some of the applicators are more expensive than others, but something in that range. Different pharmacies we've worked with have charged something like $40 to $60 a month, and it's not covered by insurance, and that's frustrating. So all of this is not going to be covered by insurance because it is not approved by the FDA. Remember, it is in Australia, New Zealand, but not here yet. Okay, so that's option number one. Now let's look at a couple of the very commonly talked about products that we could use that are designed for men. The two gels that are similar are brand name Testim and brand name Androgel. So you've probably heard different speakers talk about those two products. You can get Testim and you can get Androgel in the generic form from any pharmacy, and then you have to divide the dose so that you get 5 milligrams a day. All right, let's take a look first of all at what Androgel looks like. Okay, this is generic Androgel. It comes in a pump. Push the button, and this would be for a man, and one pump is 20 milligrams of testosterone. So when I push this pump, what comes out, I need to divide it into 4. Now that would be if I was giving myself 5 milligrams once a day. Good luck trying to divide it into 8 and do it twice a day. We wouldn't even bother with that idea. So the twice a day compounded application gives you a little bit more steady state, fewer ups and downs. We're not even going to bother trying that with the male stuff. You'd have to divide it way too many times. So 20 milligram pump, divide it by 4. I'm going to show you what this looks like, okay? This is one pump. All right. Now you have to divide that into 4. Now how could you do that accurately? And then you'd have to throw the other 3 away. Okay, so that is a big mess, and it's already dripping on my hand. Then you have to wash your hands and don't touch your kids and all of those things. So this, frankly, is not practical. It's not expensive. This pump cost about the same. It was about $45. And remember, I've got to throw away 3/4 of it because out of every pump, I'm only keeping 1/4. You can't keep the other 3. They get thrown away. So not a fan. This is generic Androgel. It's testosterone gel, 20 milligrams per pump. Even guys don't want to use this stuff. Men are going to be using, remember, 50 to 100 milligrams a day. They'd be putting 3 or 4 pumps of this all over themselves. It's not popular, hence why most men use injectable testosterone or something other than this. We don't want to use this either, in my opinion. Now, the story about how I got this is even funnier. So my very great partner prescribed it to my pharmacy, was very specific and said, have the patient deliver 1 pump and divide it by 4 such that she gets 5 milligrams once a day, and then dispose of the other 3/4. Very, very specific, a whole paragraph of instructions. I showed up at the pharmacy. First of all, it was not covered by insurance. My insurance required pre-authorization, which was denied. Unless I had evidence that I was transgender, they would not authorize me getting that product. So I said, fine, I'll just pay cash for it. The generic wasn't very expensive, but it took 3 or 4 phone calls with the physician to the pharmacist to explain that this was for female and we were going to only use 1/4 of it and throw the other 3 away. They absolutely did not understand. I felt like I was talking to someone who had never heard that women can receive testosterone. So you have to really advocate for yourself. The pharmacist is going to look at you funny. Your insurance will turn it down. If you've got a very highly motivated physician and clinical team who want to push it through, maybe you can get it done. Not to mention they didn't have it in stock. They had to order it, and it took a week. All right, so very, very difficult, but here it is. All right, now, another product you could try is Testim. So Testim is a very commonly used gel. It comes in these 50 milligram little pre-made single-use vials. So for a man, he would use 1 or 2 of these a day and then throw it away. It's a lot of wastage. So for a guy, he would use 1 of these on each side every single day. Okay, there's 50 milligrams in here. We want to get 5 milligrams out. So I have to figure out how to get 1/10 of this out of this little tube. Okay, that's tricky. So let's try. All right, and I've heard my colleagues say, well, it doesn't really matter, just do a little blob. Okay, so I can do a little blob. Is that 1/10? Is that 1/10? Is that 1/10? Is that 1/10? No, oh, now it's almost empty. I gave myself too much. You know, you could get used to making a little blob, but the argument that each of these little blobs is more accurate than the compounded product really starts to not make sense. Because remember, the whole argument about not using compounded testosterone is that it's not as accurately measured. So we should use FDA-approved testosterone because it's more accurately measured. It's monitored, right? There's no way that little blob is more accurately measured than a pump coming out of this thing. It's just impossible. Now, I went through the same elaborate hoo-ha to get this stuff. I actually prescribed that opposite for my partner so she could see what it was like to get it for herself. Same thing, it's denied by insurance. They didn't have it. They had to order it, had to argue with the pharmacist about why it was needed. Patient got a call saying it was ready, and then when showed up to pick up the prescription was told, no, we can't give it to you because the physician said you need to divide this by 10, and that's not possible, so we can't dispense it. Back and forth saying, I'm a physician, I know how to do it. With all of that, and that took several days, we were able to get this product. Now this one was more expensive. This ended up being, we had to pay cash again. It was $120 for enough that will last about 2 months. So, you know, about the same. It's going to be in the $40 to $60 range. So the cost of all of these is quite similar, $40 to $60. The difficulty of getting the right amount, I think, is vastly different. So yeah, good luck dividing this by 4. Forget it. Dividing this by 10, I mean, I would probably practice a few times using a few dummy tubes and just throw some away until you can figure out the size of the blob. Now, granted, doesn't matter if it's a little blob or a blob that's a little bit more. Probably not, because our hormones have been fluctuating all this time. But what I'm speaking to is the argument that that is more accurate than a compounded measured click device. It just isn't. That's just inaccurate. And it's coming from, I think, a very well-meaning approach, which is that we want to try to use FDA-approved products when we can, and I 100% agree. The FDA is amazing. It's great to have FDA-approved products, except for rare occasions, and that would be when there isn't one. So when there is not an FDA-approved product, that's a fantastic time to use a compounding pharmacy. Or, for example, when there's a shortage of a certain medication. Up until very recently, we had a shortage in semaglutide, Ozempic, for example, and it was made by compounding pharmacies because the pharmacists couldn't keep up. Or sometimes there isn't a correct dose for you. Like some patients, for example, for various reasons, want 150 milligrams of progesterone, and it only comes in 100 and 200. So compounding is very helpful in those situations where we don't have any other options. Now, there used to be a male patch. It's actually not available anymore because it was so unpopular. You know, we practiced trying to cut that into 10. That didn't work either. And there is actually a male pellet. It's called Testosterone. Now, it comes in 1 dose, which is generally not the right dose for a female. Men would get multiple of these FDA-approved testosterone pellets if they chose to go that way. So just to say, pellet technology is FDA approved, just not for women, because no testosterone is approved for women. But once again, I will say that using a testosterone pellet is a very valid option. It's not the best option or the only option, but it is one option. And the critical part about that is that it's dosed correctly. So there's a lot of conversation, continues onward, about pellets being bad and that they're terrible, and what's wrong with pellets is when they're dosed incorrectly. It's not the medicine that's the poison, it's the dose that's the poison. Now, you could give yourself way too much of this too. You could easily overdose on these male products, very easily, by mistake. So we don't want too much of anything, and pellets should be dosed, as I've told many times, about 1 milligram per kilogram, so very low dose. For me, I get 50 milligrams in my pellet, and I would much rather personally do that than mess with these things. So it's a personal choice. It's not bad or wrong. It's biologically identical testosterone made by a very highly regulated compounding pharmacy. It is an option, and these are also options. So they're all good options. They're just depending on your lifestyle and what you prefer. In the end, whatever we do with testosterone, we should measure your blood levels because there's so much difference in absorption between one individual and another. We're trying to divide it into blobs and we might make a mistake. Our skin is different, the temperature is different. So about 6 weeks after starting treatment with whatever it is that you choose, if you are put on testosterone, we want to draw your blood. Again, looking for about 50 to 100 nanograms per deciliter total testosterone. Now, people often say you should check free testosterone, and yes, you can. Total and free testosterone should track along about the same, unless you've got a very high level of what is called sex hormone binding globulin. So we want to check that at least once, because if that particular protein is very high, it's going to bind a lot of the total testosterone, and your free testosterone, the part that's available for use, is going to be lower than expected. But if that SHBG protein is average, then total testosterone and free testosterone, they run along concurrently. And so typically we will follow total testosterone once we've confirmed that with your initial blood work. So those are all very important points, but there's no consensus as to what free testosterone should be for females. Frankly, there's no consensus about what it should be for anybody. However, it goes to reason that we want it at the higher end of what's physiologically appropriate for a female. And the only way to know that is to draw your blood. Now, the nice thing about these creams and gels is if it gets too high, you can simply stop. The argument about pellets is always the same. Well, what if it gets too high? You can't take it out. Most important is don't let it get too high. Have it placed by a provider who does it in a very conservative manner, like we do, so that it won't get too high, and then you will be safe. So that's just a little bit about the practicality of getting different types of testosterone gel and how to put them on your body. I'm going to go wash my hands right now because this does absorb into your skin pretty quickly. So my testosterone will be a little bit higher today than usual because I've done this demonstration for you, but it's absolutely fine to do that for a couple of days. We don't have any problems having high testosterone for a short time. So if you do absorb more or you accidentally pump too much, it's okay. It gets out of your system very quickly. It's high blood levels for prolonged periods that get us into trouble with things like oily skin, acne, hair growth, hair loss in a male pattern, even deepening of our voice, growth of an Adam's apple or clitoromegaly. And these are things that we know about not because of medical mistakes so much as by treating the transgender community who want masculinizing effects on purpose. So we know how to do that. If we make your testosterone 1,000, you will have all of those effects. And in a certain population, that is wanted. And so far, it's never been shown to be harmful. So there's not anything harmful about having high testosterone. We don't want it, and those are called nuisance symptoms. That is a major nuisance to have acne and hair loss. Don't get me wrong, we do not want to go there. But the idea that it's harmful, that it causes cancer, heart attack, you name the things that I've heard, if that were true, we would have seen that in the transgender community and the bodybuilding community in a very large population who has been using high doses of testosterone for decades. So we have not seen that. So just to say, we don't want to do that in most patients. However, if so, it is safe. Those are nuisance symptoms. No, keep it 50 to 100 unless you are a transgender male, and then we would want it to be closer to 1,000. Different application. I hope that makes sense. So if you learned something today, please share this with your friends. We want to clear this up so there's no more misinformation about how we should get testosterone and whether it's bad or wrong. It's not bad or wrong. It's a fantastic idea. The dose is the poison, not the hormone. It just has to be dosed appropriately. And you get to pick. You can use the FDA-approved male product if you want to be very patient. And you've got a very good team who will try to push it through for you. Or you can get it compounded. Just click, touch, done. That frankly seems easier to me. If you enjoyed this episode, don't forget to subscribe, share it with your friends, and I can't wait to see you next week.